All right, today we're going to be covering a specific topic called thoracic outlet syndrome. We're going to go into the main details of it, what causes it, what is the primary root cause of it, and kind of what are some of the issues that can be associated or some of the issues that can kind of come up with it. All right, so here we have thoracic outlet syndrome. So what's the first thing that we can kind of ask ourselves? So the main question that we have, in patients with TOS, how does thoracic outlet syndrome cause upper cervical and upper thoracic pain or dysfunction? Some of the other topics or questions or concern is we're going to define what thoracic outlet syndrome is, what are the specific types of thoracic outlet syndrome, what are the causes of it, what issues are common with TOS, and what treatment is available for TOS. So let's first define what is thoracic outlet syndrome. So kind of here on the right, I have a diagram showing the complexity of not only the muscles, but the nerves and the venous and arterial systems that are kind of in that thoracic outlet area. So TOS is a medical condition that tends to occur when there is compression or irritation of the nerves and or blood vessels in the thoracic outlet. The thoracic outlet is a narrow space between the clavicle and the first rib. The thoracic outlet is a passage for important nerves and blood vessels. So now that we know kind of what thoracic outlet syndrome is, let's kind of see what are the specific types. So the first type is neurogenic. It's the most common type, occurring around 94 to 95% of the time in most thoracic outlet syndrome cases. It is due to the compression of the brachial plexus. So here on the right, I have the brachial plexus labeled. You can kind of see all the different nerves that kind of run from that brachial plexus that kind of originate in the cervical area. So that kind of brings us back to our main question of if there's a dysfunction there, how does it affect the cervical or upper thoracic region? So there tends to be vague pain, which is a common presentation in these types of cases. Another thing that will tend to happen will be muscle atrophy of the intrinsic muscles of the hand, accompanied by weakness of the hand with possible neurological sensory deficits. So this means that they may not perceive pain as well, light touch, even some proprioception, or even some issues with feeling hot and cold, stuff like that. Some other symptoms include tingling or numbness in the neck, shoulder, arm, and hand. Thoracic outlet syndrome tends to affect individuals who perform repetitive overhead activities. Now, this could be anybody who is like a CrossFit lifter, someone who is a electrician, a plumber who's laying on their side reaching over the head, someone who's doing duct work, construction work. Anything that just deals with a lot of overhead movement can usually lead to issues that cause neurogenic thoracic outlet syndrome. The next type is vascular. So vascular-induced thoracic outlet syndrome can be caused by compression to either the arterial or venous structures in the thoracic outlet. We have on the right here, we have a picture showing the subclavian artery and the subclavian vein, which are the two main ones that usually are affected by this. And venous compression of these occurs in around 3 to 4% of cases, and arterial is the most minimal, which is 1 to 2% of cases. So in venous, like we said, it's compression of the subclavian vein, and arterial, it's compression of the subclavian artery. Now, patients may report color changes in the upper extremity, claudication, or diffuse arm or hand pain. Now, kind of changes in color can be like a bluish tint to the hands, bluish tint to the arms, and this is just showing that there is some vascular issues on that side. Now, the third type of thoracic outlet syndrome is nonspecific, which is also known as disputed TOS. Disputed TOS is a nonspecific type of TOS that tends to occur in a large group of patients following a traumatic event such as a motor vehicle accident. Now, they'll usually have pain in the arm, the scapular region, and even in the cervical region. So now let's get down to what is the main cause of thoracic outlet syndrome. So the primary cause, as we said before, is compression of the structures in the thoracic outlet. Now, some variables that tend to cause compression are weight gain, repetitive overhead motions, whiplash injuries in car accidents, and tight muscles, which tend to be the main culprit in most of the cases. So a large majority of the cases suffer from compression primarily due to a muscle called the pectoralis minor. So we have the pectoralis minor, and one of the things that we found in the studies was that it's been noted that over 50% of the patients with TOS have an issue with pectoralis minor, and this can be either issues with tightness, dysfunction, or even weakness in these cases. So some of the signs and symptoms that we can see in most cases of thoracic outlet syndrome will be discoloration of the hand, which would be a bluish color is what I have labeled up here. We can see arm pain or swelling just because venous return or arterial delay is caused there. So the possibility of blood clots is also there. Arm fatigue with activity, and this will be kind of what they call neurogenic claudication, which means that as you perform an activity, you get tired the more you perform it, and you can't perform it as much as you used to. A common case would be, let's say someone has neurogenic claudication in their lower extremity with, let's say, diabetic neuropathy, or other issues as well that can be similar to that. The patient will be able to not walk as long as they were able to before getting tired and having that claudication occur. So we can also see some paleness or abnormal color in the fingers or hands, and then throbbing pain near the clavicle. And then arm fatigue with activity is a big one because it's going to show us one of the orthopedic tests, which we have coming up next, that can kind of show us one of the issues there. So now we can take a look at thoracic outlet syndrome orthopedic testing. So for those of you who don't know, let's kind of define what orthopedic testing is. It's a physical evaluation that gives your practitioner certain information that is needed in order to provide the best treatment modality that is specific for your case. Now, some of these orthos are called a couple different names. So we have the three best ones here are called East test, Adson's test, and upper limb tension test. So let's take a look at the first one. It's called East test, and I didn't know this, but it stands for elevated arm stress test. It's also known as the Roos stress test. So let's kind of see how to perform this. So the patient's going to have both of their arms abducted and externally rotated at 90 degrees, as we have in the picture up here. The shoulders and elbows are in the frontal plane of the chest. The patient is instructed to open and close their hands rapidly, so kind of just doing this motion. Now this can range anywhere from 60 seconds in certain literature findings or even up to 3 minutes. So normal findings in these cases are going to be, if you're having your arms do this for 3 minutes, forearm fatigue and minimal discomfort. Some abnormal findings are going to be a gradual increase in pain in the neck and shoulder area that progresses down the arm, paresthesia in the forearm or fingers, and reproduction of the usual symptoms that involve the entire extremity. The next one that we have is the Adson's test. Now this is usually performed with the patient seated. Let's kind of take a look at how to perform it. So the practitioner is going to palpate the radial pulse on the patient affected side. The patient's arm is abducted 30 degrees at the shoulder and maximally extended. The patient extends the neck and turns the head either away or towards the symptomatic shoulder and is asked to take a deep breath and briefly hold it. Now, you can either look away or towards the affected side. It just depends on the literature as well as the training of that practitioner. Some literature shows towards, some literature shows away. And you got to make sure that you compare this test bilaterally to get a baseline of the affected side versus the normal side. So normal findings are going to be that the radial pulse should be elevated when compared to the pulse taken of the arm when it's resting at the patient's side. Abnormal findings are going to show a marked decrease or disappearance of the radial pulse. Now, the third test that we have here is the upper limb tension test, which is also known as the brachial plexus tension test or ELVE test. It's also kind of like a modified Wright's test. And the reason I put all these names in here is that the names kind of tend to change over time, and it's just good to know what all the different variations are. And I saw that this one was very similar to the Wright's test. It's just that the patient is lying down versus seated. This test is performed to assess peripheral nerve mobility and compression during neurodynamic assessment. The upper limb tension test is aimed to evoke the patient's symptoms. It's a complex and dynamic test that if a negative finding is found, it can provide strong evidence for the diagnosis of brachial plexus compression. So when I was doing research on these, I wanted to see which one was the most sensitive, which one was the most specific for certain types of TOS. And kind of what I found here was that the Adson's test is best for determining arterial compression. It has a 92% sensitivity. The East test helps test for any variant of TOS, so it's just good for overall testing. I know it looks a little silly, but it's what kind of allows for testing of it. And it has the highest sensitivity at 98%. Now, the upper limb tension test tests for neurological compression of the brachial plexus, and it's best for testing for neurological issues. So now let's take a look at how chiropractic care can help with TOS. Chiropractic care is particularly useful when TOS is musculoskeletal in origin. Now, if we refer back to what we said before, from the literature that we found is that over 50% of cases of TOS are caused by pectoralis minor issues. Now, some of the treatment modalities that are available for this are some soft tissue mobilization, stretching and breakup of the scar tissue, manipulation of the spine to increase overall mobility, massage therapy, physical therapy, and even exercise modalities to allow for increased range of motion and kind of lower that compression of the brachial plexus. So now let's take a look at what does the literature say for conservative care for TOS. Now, in cases where there is not arterial or venous compression, as we know that venous is around 3 to 4%, arterial is around 1 to 2%, so that leaves us around 94 to 95% of most cases of TOS in this situation. So in cases where there is not arterial or venous compression, conservative care is the best treatment modality. This usually involves soft tissue mobilization, range of motion exercises, manipulation of the cervical or thoracic regions, rehabilitation, and even some anti-inflammatories. They also found that stretching protocols designed to target the pectoralis minor showed that they dramatically decreased pain and improved function in patients with shoulder pain as well. And just keep in mind that if you're having issues here, and even with like claudication, you're not going to be able to perform activities as best as you can for your ADLs, whether it's activities of daily living. what that stands for. And when this comes into play, you're going to have a lot of strain in not only the musculature of the upper thoracic region and cervicals, but as well as the ligamentous and osseous structures in that region. So it's going to kind of tie into that kinematic chain of how everything's affected and what it is that causes that pain in the thoracic region or even cervical region. You're going to be relying more jolting forward, not moving your arm as much. You're going to have issues kind of just in general mobility, which can kind of lead to that upper thoracic and cervical pain. So let's take a look at some of the best stretching that I found from the literature. So they said to stand in an open doorway with your hands placed at shoulder level, resting on the door jambs, and you want to stretch around 3 times a day and do 3 repetitions held for around 15 to 20 seconds each, and do around 15 to 20 seconds of rest for that same length. I found that this one was the easiest to do. This one's a little more complex. It tends to be a little more strenuous, and it can kind of place a lot more strain on the shoulder. So I recommend starting with this one. If you do have flexible joints and you are one of those people that just works on stretching, good for you. I would, start with this one. But if you're just starting off, I would start with this one and see kind of how it feels. It's a very powerful stretch, and I felt it really well. So that's really all I have there. And then here's kind of the sources that I have that you guys can feel free to look at towards the end. Now, TOS is one of those things that's just generally referenced a lot. There's no really breakdown most of the time of what it causes, but we know that from the literature, it's a lot to do with the pectoralis minor muscle. And it's just one of those things that not a lot of people harp on, so I wanted to make sure to give you guys the specific cause in most of the cases. So it can either be a cause from arterial venous compression. Most of the time it's neurological compression caused by pectoralis minor. It can even be caused after a whiplash injury car accident for that non-specific type. So just make sure to find the care that you need at the best place that's near you. And hopefully this information was helpful and informative. And if you did find it helpful and informative, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you so much and have a wonderful day.